Hello, I'm Dr. Ranade. I'm the Medical Officer of Health for the County of Lambton. In recognition of National Mental Health Week across the lifespan, I've invited two special guests to talk to you about how to address your mental health during the COVID-19 pandemic. The first is Sue Barnes, who's the Executive Director of the Clair Child Youth Services. And the second is Alan Stevenson, who's the CEO of the Canadian Mental Health Association's Lambton Kent branch. Please join me in welcoming them today. Welcome.
Thank you. Appreciate being here today.
Thanks for having us.
It's nice to see both of you. I'm going to ask you a series of questions, and maybe we can go one by one, and then afterwards we can talk a little bit more about what your organizations are seeing. So the first question for each of you is, what can people do to address their mental health in this time of COVID-19?
So I think, first of all, it's important for parents to take care of their own mental health, and I think Alan will talk more about the adult services. For children and youth, I think it's important that to recognize that children react differently to stress, and it depends on their age, their developmental level. But in general terms, I think it's important that parents speak openly with their kids around what's going on, be honest about the situation, pay attention to signs and symptoms of anxiety and depression or low self-esteem. Typically kids, when they're feeling anxious about things, will exhibit other symptoms or signs that they haven't exhibited before. And I think it's important that not only to pay attention to them, to be able to respond to your child in an open, honest way, pay attention to your child, play with your child, spend time outside doing physical activities with your kids. Keep your routines normal as possible. That helps kids, especially with anxiety, not to get dysregulated and overly upset about things. And just really listen to your children's concerns. I think another important thing is to keep an eye on signs and symptoms. And if they start interfering with their daily activities and become an ongoing thing on a daily basis, then you need to reach out for help.
Our Mental Health Week message this year is get real about your mental health. The importance of authentic conversations. We know it's actually really normal to feel stressed, anxious, and really worried in this time. Everybody's feeling it, some more than others. For some, it has become a time of great distress, and it's really critical to have authentic conversations with your friends, your partners, your peers, to share how you're feeling and get support from others, to recognize that it's okay, it's perfectly human and normal to need that support. We all need it. And to know that you can get support. If you need more than that, it's available to you. It's really critical. I think recognizing that we're all struggling with social isolation. It's really been such a change for everyone, and the importance of, again, not letting social distancing rule us to the point of not having those close connections that we all really rely on. That's critical to our mental health.
What are you seeing in terms of your services, in terms of the demand in your organizations?
So when COVID hit, we closed our physical doors and to protect our staff and the public and our clients. And we opened up right away within that week counseling through the phone system. So clients could call in, speak to an intake worker, and then get connected with a therapist within 24 hours. Since then, we've moved to both counseling by phone and virtual platforms. So with the support of United Way and the support of Talk for Tamara and the support of the Sarnia Community Foundation, we were able to buy some licensing and platforms and some computers. And our staff were able to connect from their homes and meet with clients to provide therapy, one-on-one counseling, brief services, and also we've started launching our groups now in some of our workshops. So we've been keeping our services going, so please call 519-337-3701. We are open and we're there to help you. Any reason is not too small. Just give us a call if you're feeling any distress at all.
So for us at CMHA as well, we've been open all along. moved primarily to virtual services, but not exclusively. The majority of services, though, are virtual still. We're just in the process now of thinking through how we will return to not focus as much on virtual services. What we saw initially at the very early outset was a real reduction, actually, in people reaching out for service, and we attributed that to the majority of people thinking this is a short-term thing. We just have to hunker down and get through it. But more recently, really the last 2 weeks, we've seen a real uptick in the number of people accessing our service or reaching out for our services. All along, we've been staying connected through virtual means with our existing clients, people that we've been serving for some time. That's not changed. We are finding, though, as it's becoming clearer and clearer to people that this is a long-term game changer, that we don't know what the new normal is, but it isn't. We're not going back as quickly as we thought to our previous way of living. We are seeing with our current clients an increasing level of anxiety as well, though, with people who are reaching out to us. And as I said, that is beginning to increase really in the last couple of weeks. We're seeing the severity of their needs is higher. We use the term acuity. And so people who are who in the past may have sought services earlier thinking that they were available. They may have accessed supports before their symptoms worsened. We're seeing that they've waited, and we don't want that to happen. We really want the community to know that it's okay to ask for help early. In fact, we know that when people ask for mental health help earlier, the outcomes are easier to reach, and they're often reached more quickly. So early intervention is all we use the expression early intervention is critical. It's the key to good success and good outcomes for people. So we don't want people to wait until they're in crisis. We want people to know that they can access help early on. They're more likely to have better outcomes and less distress, less disruption to their lives.
Thank you for that. So how can people who might be seeking help for their friends or family or for themselves get in touch with each of your organizations? Sue, I know you gave some details, but if you can go over that again, please, both of you. We're
seeing a similar pattern to what Alan is expressing as well. The uptick is increasing right now. And if folks want to get a hold of us, they can call 519-337-3701. And they will be connected to an intake worker, and then we'll do the intake process and see what services they need. We also have an Ontario Earlier Center, and they've been amazing right now at what they've been doing, all kinds of virtual creativity going on there. And so they have a Facebook page, which is, I wrote it down just so I wouldn't forget what it was, St. Clair Early On. And if you go to their Facebook page, they have all kinds of activities for families to do with their kids while they're at home as well. So they're doing virtual story time and virtual activities with the staff. So it's kind of really great to connect in with your kids, and they've got stuff going on. They've got a virtual calendar posted. So there's two sites you can go to, St. Clair. You can go to stclairchild.ca or the Facebook page for our Early On Center.
So the best way to reach the Canadian Mental Health Association is our 1-800 number, and that's 1-800-307-4319. And we have staff answering that line between the hours of 8 a.m. And 10 p.m., 7 days a week. And so anyone, and this is across Lambton and Kent, but anyone can access services through that line. If it is in those off sort of evening hours or on the weekends, it's going to be just a crisis response as well as a link to a follow-up on the next business day. But we will certainly follow up with anybody who contacts us within the next business day. There will be a live, I should say, normally there would always be a live answer. However, we have begun to experience higher call volumes, and so you may have to leave a number to call back. We will call you back. We're calling back at a minimum within an hour.
Great, thank you. Sue, Ellen, thank you both for spending time with me today. Thanks for the work that you and your organizations are doing to support mental health in the community. And I guess the message to everybody is there are these resources out there, and we want you to access them early if you think that you have any concern about your mental health.
Thank you for giving us the opportunity to talk with you today. And if I can give a quick shout out to our youth, they're posting their stories on Instagram. Yeah. If you go to SpokenHope_AOM for Access Open Minds, you can read their stories, and they're brilliant.
Thanks, Sue, for pointing that out as well. They are absolutely brilliant. It is really amazing to see how youth are changing the discussion around mental health for all of us, and I'm truly thankful for that. Thanks, Dr. Ranade, for this opportunity to speak with you today.
Thank you. Stay well.
You too.
You too.